Hi, dear speech language pathologists. To address today's topic of AAC. Wow, to me, this acronym means an amazing concept. I look at it as really a great concept which helps us as clinicians to either augment, facilitate, or alternate as a technique to develop communication. Many a times, or I would say of all the times, as clinicians, we are always expected to develop speech for a person, to make them learn to talk, to speak well. But we have definitely been trained, and we very well know that we need to develop the umbrella term, which is communication. And that's where we are using and we are trained to use a variety, a plethora of techniques, which we have at our exposure to be able to choose and pick what will help our client and his or her needs. So I look at AAC as one such system within that whole gamut of techniques which we have to our exposure. To use it, how, when, and in what capacity, that is where the skill of a speech language pathologist will be useful. We are trained, and we need to be further trained to be able to judiciously pick up, select the right system, select what is appropriate for the person, and then help the person develop his communication, speech, language. Then why this resistance and why the reluctance amongst the society, people, as well as amongst professionals, that we resist the use of AAC simply because it's thought that it will lead the person to become a signing person or not use speech. To this, I totally disagree. For I have used AAC for as much as, I would say, 30 years. And over that period, have used it more as a facilitator to augment speech and language therapy, to help me develop children as well as adults, to help them use good communication skills as well as speech and language. There are a variety of options available to us nowadays as far as the different AAC systems are concerned, coming from right from the simple, natural gestures, signing systems, symbols, which we always see in society, to the use of communication boards, to the use of a range of apps which have come in with technology. Wow, we have a whole range at our exposure to be able to select and choose the best which will suit our client and his or her needs. But yes, when will this be possible? We are not going to be able to use this unless we ourselves are convinced that it will help. It is that conviction with which you can then help to make the client, the caretakers, the family, or the individual, child or adult, to be able to use an AAC system or a strategy to help as an augmentative or as an alternative mode. And we all know that today it is the right of every individual to live with dignity in society, the right of inclusion. And what more can help us, especially when we have severe challenges in people where they have to struggle to communicate, that lead to behavioral or emotional disturbances. Here is an avenue which we could try and use judiciously, I would say, yes, and help the client to develop communication. I have used AACs with a variety of speech language disorders in pediatric and geriatric age, language disorders, ASDs, ADDs, cerebral palsy, intellectual deficits, voice disorders, aphonias, with tracheostomy, with aphasia, dysarthria, and neurocognitive communication disorders. Yes, we need a paradigm shift in our perspective of viewing speech language therapy as a speech language communication therapy. And I'm sure this would help our clients much more than it will help us get the results. Thank you.